This is a case report regarding Pyoderma gangrenosum as seen in wound clinic. Pyoderma gangrenosum is a rare neutrophilic dermatosis that's pathophysiology is pretty poorly understood but thought to be associated with neutrophil chemotaxis. It consists of rapidly enlarging, painful, necrotic skin ulcers associated with systemic autoimmune disease. And it's a clinical diagnosis with a pretty wide differential, including arterial or venous insufficiency, insect bites, anthrax, traumatic ulceration, atypical infections, and much more. And for that reason, you need a pretty thorough history taking and specific criteria for the diagnosis to be made, and that's where the Paracelsus score comes in. So the Paracelsus score has point designations for major, minor, and additional criteria, and a score of at least 10 is used to assist in diagnosing. The patient was followed on different occasions in wound clinic for 2 distinct shin wounds that were in the same general region. These were treated with antibiotics and compression therapy, and ultimately the second time she came back, she was started on multiple steroids that were both topical and systemic when Pyoderma gangrenosum was suspected. During this time, we also discovered that she was worked up separately for GI symptoms that we asked about later on. She was discharged from the clinic in January of 2023 with approximate wound closure. After questioning a possible diagnosis of Pyoderma gangrenosum and reviewing her symptoms, her PCP obtained labs with the suspicion of possible inflammatory bowel disease, and of those labs, these were the most relevant. And as you can see, her RF and her CRP were increased. Pyoderma gangrenosum, which typically presents as a small inflammatory pustular papule that expands, creating a necrotic, painful ulcer with characteristic blue-violet reddish ragged borders, usually impacts people between the ages of 20 and 50, and half of the cases are associated with underlying systemic conditions. A clinical diagnosis scoring system is important for this diagnosis because a biopsy is only useful for ruling out the diagnosis, and that's where the Paracelsus criteria comes in. In this case, the major criteria she met was the progressive nature of the disease, absence of other differentials, and the reddish violaceous wound border. The minor criteria she met were amelioration of symptoms with immunosuppressants as well as pathergy, and she also met some additional criteria with an undermined wound margin and possibly associated systemic disease. We need to keep a holistic approach with our patients, prioritizing thorough history taking, interspecialty communication and consultation, and follow-up. The patient's symptoms were indicative of an underlying process, so though diagnosis of Pyoderma gangrenosum was a barrier in that once it's crossed, it's important to acknowledge associations when they're present, because her gastrointestinal symptoms weren't considered until we followed up on the association. Wound care, primary care, her naturopath, her rheumatologist, and her gastroenterologist all played a role in her care, but a significant role was played by the patient herself. Thank you to our patient for being willing to participate in research efforts.